Yeah, good morning, everyone. Yeah, is my voice audible to all of you? Let me see who all are present today. Yeah, who all are present today? Yes, a very lovely good morning to all of you out there. Yeah, good morning. Good morning, Nyaila. From where are you? Which place you belong, beta? Yeah, good morning, Reddy. How are you doing? Yeah, good morning. Good morning. Yeah, good morning. Okay, good. So, today we are going to start up with the regulation of blood glucose, right? Yeah, hi, good morning. New content for you. Okay. So I can see some newcomers today in the class. So today we are going to discuss glucose homeostasis or regulation of blood glucose. Now let me just give you a brief. Okay, thank you so much, Reddy. So I hope you people have attended all the sessions, right? Because we started with the metabolism and chemistry of carbohydrate last week, and today we will be discussing the regulation. Okay, from Northeast Assam. Okay, right. So now I'll just tell you about we eat food containing carbohydrates. Yeah, good morning, Sheikh. So whatever food we eat, we all know that it is rich in carbohydrates, whether they are potatoes, whether you can say the flour is there, we eat parathas, we eat puri, so many things we eat, which all are rich in carbohydrates, okay, or carbs. So if we talk about the basic thing about carbs, we all know that we have discussed in this that polysaccharides are broken into monosaccharides first, and these monosaccharides, in which the physiologically the most important monosaccharide is glucose. Because if we talk about galactose, galactose is a C4 ampere of glucose, it can be converted. Similarly, if we talk about fructose, fructose is also a ketoisomer of glucose, so it can be converted to glucose. So I can say the main hero here is glucose, right? Okay, ready, no problem. If you are attending the this lecture, after finishing with this lecture, वैसे तो I'll try to cover what all we have discussed in the last week, last sessions. But still, if you have any problem, you can ask me there and then. And you guys can follow my Telegram channel also. In that PDF of the notes which we discuss daily are there. So you can just go through the notes. And my Telegram channel is Biochemistry by Dr. Pooja Johari. Right. So this is glucose. So I can simply say, definitely beta, I will come to that. I am going to teach because hormones are the ones which play a very important role in regulating the entire metabolism. So now see, what is this homeostasis? Homeostasis means homeostasis. Okay, it means that rate of input of glucose, the factors which are leading to the formation of glucose, right, they should be equivalent to rate of output of glucose. Yeah, I'll just write glucose in the center. It is like this: rate of input of glucose should be equivalent to rate of output of glucose. Means whatever carbohydrates we are having in our diet, whatever carbs they are leading to the formation of glucose, they should be equivalent to the rate of output. Means how glucose is utilized in the body. Clear? This is what is metabolism all about. So what are the factors? If I talk about the factors which can lead to glucose, the most important one is our diet, isn't it? Whatever we have, it is forming glucose. Then other factors along with the diet which give rise to glucose, the most important one is here glycogenolysis, isn't it? Which we have studied, degradation of glycogen to form glucose. Similarly, gluconeogenesis. Right? So these are the factors which are forming glucose. And rate of output of glucose means that glucose is required to give energy to the body. So it is utilized by glycolysis. Glucose is degraded. Similarly, excess amount of glucose will be stored to form glycogen. Right? And we can say glucose can also undergo HMP shunt and uronic acid pathway. So these factors, when they become equivalent to this factor, it means the net concentration of glucose should be between 70 to 110 milligram per dl. Okay. So this is what is homeostasis, ki the factors which are, we will call that person as a healthy individual, where this will be the fasting level plus the normal level also. Okay, so I can simply say that the rate of input of glucose is equivalent to rate of output of glucose. So the net concentration of glucose in a healthy individual remains 70 to 110 milligram per dl. If there is increase in the concentration, we call that condition as hyperglycemia. Right? If the concentration of glucose is less, we call it as hypoglycemia. Hyperglycemia, the refined name is diabetes mellitus. Clear? So this is what is the entire this thing of glucose. Now see, there is one normal or fasting range, okay, and there is one post-prandial limit also. Post-prandial is after food, right? And we always divide our body into three stages. One is the fed state. I will be discussing everything here. Fed state, जिसको हम बोलते हैं well fed state also. Fasting stage, which can be early, which can be late fasting, and then comes starvation. Starvation is prolonged fasting. Is it clear? So the metabolism is divided into these three stages: fed state, fasting stage, starvation stage. Increase in the concentration of glucose is hyperglycemia, and decrease in the concentration of glucose is hypoglycemia. And if we talk about the normal concentration of glucose, it is 70 to 110 milligram per dl. So in this topic, in the homeostasis, that is what I am trying to explain. During fasting, if the blood glucose decreases, there are other factors also which lead to the formation of glucose. Getting my point? That is what is regulation all about. Okay, AB. So that is what is homeostasis, which we will be discussing here. Now coming over to this, now see, how blood glucose is regulated. Obviously, normal plasma glucose is there. Factors which are maintaining glucose, postprandial regulation, regulation during fasting, and what is the clinical aspect of this. This all we are going to cover. Right. Up so far we have studied, just now I told you, because glycolysis we have studied in detail. Glycogen metabolism also we have studied in detail, right? HMP shunt also we have studied in detail. Similarly, glycogenolysis and gluconeogenesis, this all we have covered in detail. Okay, so those who have not attended the lecture, they can just download my PDF notes on my channel, and still you guys have any problem, don't hesitate to ask me anytime. Okay, so now what we are going to study is, just now he said role of hormones. So always remember beta, if we talk about the hormones, basically there are two antagonistic hormones which play a very important role in the carbohydrate metabolism. One is your insulin, right? And second is your glucagon, along with epinephrine. Right? So there is a coordination. There is coordination. Just suppose if I give you one assignment, okay, and you have your friend, which is who's studying with you. So you will have a coordination with him ki how you have to plan your studies. Same is the case here. Insulin and glucagon are meant to work antagonistically. Okay. So whenever the level of glucose will be more, insulin will become active. And whenever the concentration of glucose is less, glucagon will remain active. So they will give instructions to each other which has to be released when. Clear? So now see, if I talk about, I'll just take you to the slides first of all, then see. What is glucose homeostasis? It is maintenance of blood glucose level within the normal range. Yeah, ready. I daily take the class from 11 to 1. My timing of the classes is fixed. I'm taking classes from 11 o'clock in the morning till 1 o'clock. Okay. Then the blood glucose level must be maintained within the normal limits of 70 to 110 milligram per day. Clear? Up, if I talk about this, now you are going to tell me, dekho beta, the processes are lying in front of you. These are, chalo, I'll just write the processes here. Dekho, this is glucose. Okay. Here I will write insulin. And here I will write glucagon. Right. Suppose if I talk about glycogenesis. One example I am taking. Right. You know glycogenesis kya hai? It is the formation of glycogen. And I told you whenever something is produced, it is an anabolic process. Okay. That means it is utilizing glucose. Right. So glucose will be converted to glycogen and it will be stored. Now coming over to this, now I ask you, what will be the mode of action of insulin? Insulin is an anabolic hormone. Always remember one thing. Yes, it occurs in the liver and muscle, right? So insulin is an anabolic hormone. That means what is its function? It will increase the synthesis of something. So insulin is going to increase glycogenesis. Right. Then if I talk about the second process, say glycogenolysis, I'll write it here. If I talk about glycogenolysis, here what is happening is glycogen is being broken down. It is broken down to form glucose. Okay. Now what role will insulin play? Insulin is just acting as an anabolic hormone. This is a catabolic process. So this will be accelerated by glucagon. And if I talk about insulin, insulin is going to inhibit glycogenolysis. Similarly, glucagon is going to inhibit glycogenesis. Getting my point? This is what is your regulation or homeostasis. This is what we are going to study in detail in this following video. I hope you are understanding what I am trying to say. Insulin, we call it as a anabolic hormone. Always remember this. Glucagon, on the other hand, is a catabolic hormone. Right? So always keep one thing in mind. Yeah. If insulin is an anabolic hormone, I told you anabolism, synthesis of something. So it is going to promote all those processes which will lead to the synthesis of something. On the other hand, glucagon is a catabolic hormone. It will break. Right. Up now coming over to this. Okay. If I talk about when the body will undergo, breaking of the substrates, when the body is undergoing fasting, isn't it? Fasting may the substrates have to be broken down because the body already requires energy. Clear? So glucagon will always act during fasting and insulin will basically act in the fed state. Haki exceptions are there. Exceptions we will be discussing later, but right now I'm just trying to give you the overview of this, how insulin and glucagon are related to one another. And this is how the accordance is, this is what is equilibrium. When the concentration of anabolic means, but anabolism is synthesis of something. That's what I have actually explained. Wait, I'll write it here. Anabolic reactions. Yeah, anabolism is synthesis of something. Which means that A plus B will form C. So when C is produced, obviously some energy is required. Okay, energy kahan se milegi? Energy we will get from the food, from outside. So anabolic reactions will occur mainly in the fed state. Okay, fed state means fed, feed karna, means when we are already having something in the diet. On the other hand, another one is catabolism. Catabolism is breakdown of something. Or in a nutshell, if I say that A plus B is forming C, C will be broken down to form A plus B. Clear? So energy will be released. So catabolic reactions takes place during fasting, because fasting, हम लोग fast रखते हैं. When we are keeping a fast, we are not having anything from outside diet. So whatever is there in the body, that will be degraded to give energy to us. Because again, our heart and brain, they are the two organs which just cannot stay without energy for even a second. Okay, so this is anabolism and catabolism. And you know, anabolism plus catabolism is equivalent to metabolism. So anabolism plus catabolism is equal to metabolism. I hope it is clear to all of you. Clear हो गया बेटा? Right. Up coming over to this, that is what is written here. Clear. Now if we move to this is the okay. So normal blood glucose level, if we talk about normal or in fasting, we can simply say that it is 70 to 110 milligram per day. Post-prandial can go up to 120 to 140. Right. Above and below the normal levels is considered as abnormal. So abnormal, hyper means when the concentration of glucose is above the normal range. Hypo when the level is below the normal range. So this is hyper and hypoglycemia. Normal individual, if we talk about, normal individual will have the normal concentration of glucose. Okay, and a diseased individual will have an abnormal concentration of glucose. Now the question arises, what are the factors which can lead to abnormal concentration of glucose? जैसे commonly I'll give you one, जैसे diabetes. If we talk about diabetes, there are so many reasons which can lead to diabetes. Okay, diabetes mellitus. But here nowadays, if we talk about type 2 diabetes, what we are doing? We are just eating, sitting, and obviously listening to the lectures. Right? So no metabolic activity is there. Clear? So there what will happen is, there it will lead to diseases known as diabetes mellitus. Okay? So now see, this is a very good slide. What are the factors? What just now? Hyperactivity, we mean activity is better when we are doing any work. Hyper is when we increase it. So when the activity increases, it becomes hyperactive. Okay? Hyperactivities जैसे कई होते हैं ना, some are very hyperactive. Suppose if you tell, so many children are there, hyperactivity, maybe there are so many reasons. Suppose some hyperactive children, they cannot sit on the sofa for a minute. They will keep on thinking something, and they will keep on thinking either something destructive, constructive, so where do they think? But like that. So that is hyperactivity. Hyperinsulin, beta, that is insulin resistance. Hyperinsulin, nahi, insulin resistance is there. I'll come to that. Okay, AB. So, blood glucose, insulin resistance means the person is resistant to insulin. Means insulin is not working properly. There are so many reasons to it. Okay, here actually I am just teaching you as per biochemistry angle. Otherwise, if we start discussing this, if we start discussing, I should say, the entire diabetes, it will take full day to explain it. But here I am just giving you the basics, giving you the basic knowledge so that you should know what is the underlying cause of that. Okay. So if I talk about blood glucose is 70 to 110 milligram, this is the most important factor which is forming glucose from the diet. Okay. Then glycogenolysis, right? And this is gluconeogenesis. Now this gluconeogenesis, again I have discussed in my video that this is synthesis from non-carbohydrate precursors. Right, non-carbohydrate precursors means amino acids are there, fatty acids are there. There are so many non-carbohydrate precursors. Okay. Up, how glucose is used? It is oxidized. Jैसे glycolysis is there. Right. It is used in the storage form as glycogen. So it is glycogenesis. अब बेटा see, genesis is formation किसका? Of glycogen. So formation of glycogen is glycogenesis. Then conversion, excess of glucose is converted to fats also. Lipogenesis is formation of fats. So you can just simply imagine, if the concentration of glucose increases, what are the side effects of this? Fats also increases, right? Fats cannot be converted to glucose, but glucose can be converted to fats. That is why if we restrict carbohydrate in our diet, we will be much more happier, and we will be much more fit also. There are so many diets also which are coming nowadays. Atkins diet is there, then intermittent fasting, keto diet, so many diets are there. So the diet is assigned, it will be very beneficial for you. You are a physiotherapist, no doubt. Physiotherapy, maybe biochemistry is there. And see, this is a basic subject. Physiotherapy, why it is important? Because you need to know. If you are a physiotherapist, you can become a good, dietitian also. You can guide about the diet. You can tell about the focus on the muscles. that whenever this exercise is there, whenever you have some cramps, what should you avoid in the diet? So physiotherapist ke liye biochemistry is equally important. And this is a general topic also. But basically we are catering to first year MBBS students, so that because they get a essay type question, like 10 marks question, 15 marks question, that how blood glucose is regulated, write a detailed explanation of that. Okay. Now this is very, very important. I told you our body has three main stages. One is the fed state, okay, fasting stage, and the starvation. Okay, and now if I talk about well-fed state, well-fed state is जैसे कहते हैं ना खाते पीते घर के, it will start 1 to 4 hours after food. When you are eating something, obviously the body will undergo absorption. So post-absorptive stage will be the well-fed state. Exactly 1 to 4 hours after, 1 to 2 hours, 1 to 4 hours after this. Now, in the well-fed state, all the anabolic reactions will be accelerated, isn't it? Yes, for FMG students also, this is very, very important, really, very, very important. Because in FMG, straightforward questions are, these are the basics basically. In FMG, if I talk about that question, how question will come, the rate limiting enzyme of glycogenesis, the rate limiting enzyme of glycogenolysis, fed state, fasting stage, ketone bodies, these are the questions which are asked, which we will be discussing now. So for FMG students, it is equally important. For NEET PG students also, this, but the subject remains the same. Biochemistry will be same, whether it is for physiotherapists, whether it is for nursing students. The only thing is that the syllabus varies. But these are the general topics which are covered in all the medical disciplines. That's what I told you people in my first lecture also, whether MBBS, whether BDS, whether physiotherapy, whether nursing, anything related, even MLT. For MLT students, this is very, very important. But yes, MLT part requires practical exposure also. Here practical exposure is, little less, because we are concentrating mainly on the theory. So well-fed state is 1 to 4 hours after food. So all metabolic pathways will be active. Anabolic. Metabolic में anabolic. जैसे for example, glycogenesis will be active. Right? HMP shunt will be active. अच्छा active तो ही है. Then uronic acid pathway will be active. These are the ones. Then if we go towards fasting, just suppose if you have your breakfast, okay, suppose you take your breakfast at around 8 or 9 o'clock just before attending the sessions, automatically your body will go in a fed state. Suppose you skip your lunch. Lunch means you are increasing the time interval of food intake. So your body will undergo fasting. Fasting, maybe early fasting is there, which is 4 to 16 hours after food. Then also we are getting energy, isn't it? But from where we are getting energy? Now fasting may the breakdown processes will take place. Obviously, because just now I told you कि if C is broken down into A plus B, energy is released. So all the things which are broken, they will be mainly accelerated. जैसे glycogenolysis, breakdown of glucose, breakdown of glycogen to form glucose. Then comes thoda sa और we are increasing the time interval of fasting. This is suppose if you skip your lunch, right? You will wait for dinner. Obviously, you will be hungry. Up if the dinner also is not of your choice, maybe you are not liking whatever is made in the dinner. ठीक है, हो सकता है you people must be wanting to have, say, for example, dal rice, but some other vegetable is there. So those who are staying in the hostels, yeah, those who can throw tantrums in front of their mothers, they will simply say no mama, I don't want to eat this, isn't it? इसका मतलब क्या कर रहे हो? What you are doing is you are increasing the time interval. That means your body is undergoing again fasting, delayed fasting. So this again 16 to 48 hours after food. Then what will happen? Gluconeogenesis will be. Why? Because glycogen stores are depleted by 18 hours. मतलब 16 to 18 hours में glycogen, whatever stored form of glucose is there, it is in the form of glycogen, it will be finished in this 12 to 16 hours. Okay. Then which process will occur? Gluconeogenesis, because body requires glucose, isn't it? So other source of glucose will come, which is gluconeogenesis. Right. Ab chalo, if you are annoyed, okay, you are skipping food. 1, 2, 3 days हो गए. Body कितना break करेगी? What all is there inside? Body has already shedded off that. Degradation of glycogen is there. Then you can say formation of glucose is there. Then what will happen? Body will switch over to other modes. Other modes are what? Except carbohydrates, what we eat? We eat proteins. We eat fats. So these proteins and fats need to be converted into carbohydrates, right? So during prolonged fasting, we call it as starvation. It starts after second day. Okay, so gluconeogenesis will be there, but the fatty acids will start breaking, which is known as fatty acid oxidation. Okay, so and we all know that fatty acids are the instantaneous source of energy, so it will be broken. And ketone body synthesis. अब देखो कीटोन बॉडीज बेटा क्या होती हैं. जस्ट रिमेंबर वन थिंग अबाउट कीटोन बॉडीज, बिकॉज आई एम गोइंग टू डिस्कस कीटोन बॉडीज इन डिटेल इन फैटी एसिड मेटाबॉलिज्म. Here just remember ketone bodies play a very important role during starvation. They are the fuel in starvation. Right? And then comes beta DKA is diabetic ketoacidosis. Very good. In diabetic ketoacidosis, obviously ketone bodies increases. That is why it is known as diabetic, because the person is diabetic also. See, starvation and diabetes, they are more or less the same condition of the body. Starvation when we are not taking anything. Diabetes means glucose is there, but it is not being utilized. So the tissues are starving. They are craving for energy. So from where the energy will come? It will come from ketone body. That is why if the concentration of ketone bodies increases, it is known as DKA or diabetic ketoacidosis. Then prolonged starvation, more than 5 days. Then muscle proteolysis will start by, there will be breakdown of the proteins in the muscle. Okay, we call it as breakdown of proteins. Right? So we call it as a fast feed cycle. Fast feed means it's a cycle basically when we are having consumption of that, then fasting, then again feed. So fasting, then going towards this fed, then going towards fasting, then again feeding a child or feeding ourselves. So this is known as fast feed cycle. Right? And then this is what is the homeostasis, how it is maintained. This is just now already also asked, what is the role of hormones? If I talk about, see, whether the concentration of glucose is high, whether the concentration of glucose is low, that means under hyperglycemia, this is hyperglycemia and this is hypoglycemia. Okay. So if I ask you, if the concentration of glucose increases, what should be the duty of pancreas? The pancreas have a duty to release insulin. And what insulin does? Insulin will start utilizing glucose. It utilizes glucose. On the other hand, if hypoglycemia is there or low blood glucose is there, glucagon is released. Glucagon will form glucose. Dekho, difference is here glucose is being utilized because glucose is more in concentration. Here glucose is being produced because glucose is less in concentration. Clear? So glucagon will be released and production of glucose will be there. Production of glucose. One second, ready. Main point to remember is low energy leads to catabolism. Yes, right. In a layman's language, okay, if I have to explain in a layman's language, as just now Reddy also mentioned, whenever body requires energy, okay, jaise suppose we go to some shop, we go and buy something, we always spend energy, right? In our body, energy is bought. How energy is bought? By this coin. Okay, so coin is ATP. So we are buying energy. Up if we are buying energy in the body, how energy is produced? Energy is produced by the breakdown of something. This is same what you have studied in chemistry, beta, law of thermodynamics, first law of thermodynamics. Energy can neither be created nor destroyed. It is simply converted from one form to another. So anabolism is synthesis of something where energy is given to synthesize. On the other hand, breakdown is breakdown of something where energy is released. ठीक है, as simple as that. अब यहाँ पे we are talking about the abnormal when the concentration of glucose is increasing. अब ऐसा तो नहीं है ना कि if the concentration, because glucose keeps on fluctuating, किसी में low, किसी में high. So what happens is internally our body is well assigned to fight with these type of things. So if I talk about pancreas, pancreas have alpha, beta and gamma cells. Alpha is secreting glucagon, beta is secreting insulin. So they are automatically working in accordance with each other. They are antagonistically working with each other. Glucose ka concentration increases, insulin tries to bring it down. On the other hand, if the concentration of glucose is dropped, then glucagon is there which tries to keep it up. So one is bringing down, one is raising up. That is why it's like a seesaw. It maintains the equilibrium. Right? So when it increases, utilizes glucose. So what are the processes which utilizes glucose? Similarly, production of glucose means what are the processes which release glucose. So there is a equilibrium or a kind of, I should say, harmony between them. Is it clear? Clear hua beta? Now, what are the metabolic processes? What is the role of hormones? And what is the renal mechanism? This all leads to homeostasis of blood. It's very, very. Okay, let me see. First is up. See. Wherever you find any problem, I will explain. Okay, now see, as blood sugar tends to increase, means hyperglycemia. What will happen? Insulin will be secreted. Okay, we have to utilize glucose now. How we can utilize? We can increase glycogenesis. Okay, then we can increase HMP shunt, because all those processes which are accelerated, yeah, which are related to utilization of glucose, means glucose utilize hoga. Plus here, now see, glycogenesis will be increased, accelerated, then fats synthesis also will be increased. Okay, but chalo, fats we won't take here because we are basically studying the metabolism of only carbohydrates. So for first year students it will be difficult to understand at this moment, right? We will just stick to the only those processes which you people have studied, right? So glycogenesis is accelerated and HMP shunt is accelerated. Now there is an exception, beta. Exception kya hai? Here glycolysis will also be accelerated. Right. Now can anybody tell me why glycolysis will be accelerated? Anyone? See, glycolysis will be accelerated only because of one simple reason, that it is utilizing glucose. Bas, that's it. Here, so it is utilizing glucose, and what is the outcome of that? Utilization of glucose by tissues is increased. Right? So as blood sugar tends to increase, hyperglycemia is there, then excess amount of glycogen will be synthesized, the HMP shunt will increase, and glycolysis will also increase. It is an exception basically. Is it clear? And if blood sugar tends to decrease, yani ki the condition is hypoglycemia. Up now the condition is that the body is craving for glucose because the concentration of blood sugar has decreased. So the processes which will lead to the formation of glucose, they will be accelerated. So I can say that secretion of insulin will now decrease. Now whose secretion will increase? Increased secretion of glucagon will be there. Got my point? And obviously, if the secretion of insulin decreases, insulin to glucagon ratio will also decrease. Right? So now what will increase? Gluconeogenesis will increase. Glycogenolysis will increase. So that the tissues get glucose and they can now function. Clear? Clear हुआ बेटा? If the topics are clear to you, na, you can give me a thumbs up also. Right? Vrushali, are you there in the class? Vrushali, Animesh. Okay, right. Okay. So I hope this is clear to all of you. Clear? Now, after this is what is the fundamental regulatory mechanism. Hyperglycemia will lead to anabolic processes. Hypoglycemia will lead to catabolic processes. Alki, there is an exception. Glycolysis is an exception and gluconeogenesis is an exception. This again I will explain later. Now coming over to this diagram. Now see beta, what happens is blood glucose during well-fed state. Okay, clear, no? Right. Well-fed state. Now you have you understood the difference between fed, fasting and starvation? ये बहुत important. Okay. Fasting is fasting is like early fasting is there, late fasting is there, prolonged fasting is starvation. Always remember. Okay. और वेल फेड स्टेट इज फेड. ऐसे याद रखो, फीड, जैसे इफ वी फीड अ चाइल्ड, नो, उसको खाना देते हैं हम खाने के लिए. सो वेल फेड स्टेट इज व्हेन ऑलरेडी द बॉडी इज अंडर, the body has already taken food from outside. अब now see, ये देखो, ठीक है. अब if I talk about C, what is the role of pancreas? First of all, we can simply say that these pancreas will release insulin. What is the function of insulin? Insulin will utilize glucose. Now, how insulin is going to utilize glucose? It will increase the absorption. isn't it? And that we have already studied under, glucose transporters. If you remember, insulin dependent glucose transporter is GLUT4, rest are insulin independent, isn't it? So when it takes, so excess of glucose, if I show you here, this glucose will be converted to form glycogen, right? Excess glucose will be converted to form glycogen, and glucose will be oxidized via glycolysis, right? Pyruvic acid will be produced and fatty acids will be produced. Fats will be deposited in the adipose tissue. On the other hand, pyruvic acid is forming lactate also. Glucose is entering in the RBCs. The function is glucose is entering in the RBCs. In the muscle, if we talk about muscle, mein lactate is being produced, right? And this is how glucose is being broken down. Is it clear? Yahan pe bhi I will just explain it to you with the help of this. See, we are having, first of all, you just have a look at the diagram and I'll explain you what is happening here. Here is, you can say, during well-fed state. Well-fed state means, abhi just now I told you, feeding a child. Already khila diya hai. So obviously the concentration is more of glucose. Immediately insulin, because GLUT2 is the one which is responsible for transporting them to the pancreatic cells. Okay. So when glucose is more, it will be utilized. How it will be utilized? It will be immediately sent to the kitchen. Kitchen kya hai hamara? Kitchen is the liver. And there it will be stored to form glycogen in the liver as well as the muscle. Because जैसे कोविड के टाइम what we did was कि whenever the market used to be open for 2-3 hours, so what we used to do, we used to go for those 2-3 hours to the market and collect all the stuff and store it in the godown, so that whenever it is required, we used to take out the stuff from the godowns and we used to cook, and we used to manage for days and days. Same is the case with our body. Our body will simply use, you can say, put glucose in the form of glycogen, so that at night, yeah, so that when we are not having anything, glycogen can be broken down. Okay. And on the other hand, glucose is giving energy by glycolysis, because glycolysis is giving energy mainly to the RBCs, and it is being converted to lactate in the muscle, right? So this is utilization of this, and the most important function is by the brain, because our brain depends on glucose for energy during the fed state as well as the fasting stage. Starvation may, no doubt, brain has to go on ketone bodies. Brain has to literally beg for energy, and the only source of energy left during starvation is the ketone bodies. Okay, so this is glucose regulation during well-fed state, right? Then opposite is blood regulation during postprandial state. Okay, if we talk about this postprandial state, you will see that how the metabolism has changed. If I talk about pancreas here, now they will release glucagon. I'll just zoom it so that it will be clear. वहाँ पे it was insulin here, if you remember. Here it is glucagon. Up here, what is happening is glycogenolysis will be there. Means the body requires energy. So glycogen will be broken down to form glucose. And this glucose will basically be, obviously, it will give energy to the RBCs, right? Muscle mein what will happen? In the muscle, pyruvate will be converted into lactate. This all we have discussed also, beta, if you remember. RBCs cannot use ketone bodies. You are right, ready. That is why RBCs always depend on glucose for energy. Whether it is the fed state, whether it is the fasting stage, whether it is starvation. I'll just write, wait. देखो I'll write, see, 1 second. See beta, brain is there. I'll just compare these two. Okay. Yeah, because RBCs lack mitochondria, correct. I'll just discuss these two. Then later on we will discuss others. This is the fed state. This is the fasting stage. And this is starvation. Okay. So if we talk about energy, brain will require glucose in the fed state, right? Glucose in the fasting stage, and starvation may it requires ketone bodies. And if we talk about RBCs will require glucose in the fed state, glucose in the fasting stage, yes, and glucose only during starvation. No ketone bodies. Why no ketone bodies? Because ketone bodies are synthesized also in the mitochondria. So no ketone bodies as they lack mitochondria. Yes, very good. It's like GGG, triple G. जैसे ट्रिपल आर मूवी वॉज देयर नो, वैसे रिमेंबर ट्रिपल जी फॉर RBCs. Okay, so this is very important. Now coming over to this, so what we were discussing, so I was telling you कि glucagon is released, so glucagon will accelerate the catabolic processes. We know that glycogen will be broken to release glucose, right? Then lactate will also be converted into glucose. On the other hand, you can see brain again on glucose. Right? Is it clear, beta? This is blood glucose regulation during postprandial state. Right? Then after this, then we come over to, this is what is homeostasis. Homeostasis means we can say that pancreas secretes insulin, right? Insulin, what insulin is doing? Now this is again a very clear picture and a very interesting picture, I should say. Insulin will convert glucose to glycogen. Muscle will also store glycogen. And adipose tissue uses glucose to form fats. Matlab fat state mein this is happening. This is going on. Ab now see, if high blood glucose is there, homeostasis is maintained, right? And after that, when the level of glucose is low, then what will happen? Pancreas will secrete glucagon, and this glucagon will now trigger all the catabolic processes, so that again the body takes glucose. So it is like breakdown and synthesis of glucose. Very important, right? And this is what is the role of hormones. That is what we are discussing till now. If I talk about high blood glucose, signals to release of hypoglycemic hormone insulin. Now, why insulin is known as a hypoglycemic hormone? Can anybody tell me? Because it is released, when it is released? During hyperglycemia. So obviously, if it is released during hyperglycemia, it will tend to bring the glucose level down. So it is a hypoglycemic hormone, right? On the other hand, if we talk about then low blood glucose, if the blood glucose drops down, then hyperglycemic hormone will come, because this is hypoglycemia. Then glucagon will be released. So hyperglycemic hormone glucagon will be there, which will increase. So क्या हो जाएगा? When it is high, it is brought down. When it is too low, it is raised up. So it's like again that equilibrium process, which we often refer to as what? It is a homeostasis of blood glucose, right? This is what is regulation. Now, if we talk about insulin, okay, what is the function of insulin first of all? Insulin is a, I'll just write it here. It is a hypoglycemic hormone. This you have to learn, beta. Now, why it is a hypoglycemic hormone? As it is released during hyperglycemia. So, insulin plays an important role in storing the excess energy. Yes, very good, ready? Insulin plays a very important role in storing the excess energy. So, in the case of excess carbohydrates, it causes them to be stored as glycogen mainly in the liver and the muscle. And all the excess carbohydrate that cannot be stored in glycogen in the form, it is converted to fats and it is stored in the adipose tissue. It's understood whatever amount of glucose is there, no, it is converted into fats and glycogen left over into fats. Glycogen in the liver as well as the muscle, and if we talk about the fats, it is in the adipose tissue. Yes. Okay, clear. Then what is the chemistry behind insulin? Insulin is actually a peptide hormone. Very important, and we all know that insulin has 51 amino acids and 2 chains, isn't it? So it is produced by beta cells of pancreas. It is a small protein with only 51 amino acids. It has a molecular weight of this. It is composed of two polypeptide chains connected to each other by disulfide linkages. Two polypeptide chains. Okay. And this is how, this I am just showing you the diagram. We won't take it into that much detail. So here you can simply say that this is pre-pro insulin. Whenever insulin has to function, अब देखो बॉडी में क्या हो रहा है, इसको हम बोलते हैं एक तरह से सेल सिग्नलिंग. Okay, suppose if you make a WhatsApp group, isn't it? WhatsApp group क्या करते हो तुम कि you have to send a message to your one of your friend. So automatically, if you send to one of your friend, automatically signals will be given to all. Same is the case here. If there is increased concentration of glucose in the body, immediately signals will be sent to the pancreas. They will release beta cells of pancreas. They will make insulin active. Abhi just now one student mentioned about insulin resistance. उसमें this is the one which is faulty. The person becomes resistant to insulin. इसका मतलब क्या है कि उसमें insulin cannot act there. Okay, so this pro-insulin will, the chain will break. Basically, this chain breaks and you can say insulin is released. This is the active insulin. Okay, because right now when no function of insulin is required, it will be lying as such. It will be triggered only when the concentration of glucose increases. Glucagon will be triggered only when the concentration of glucose will decrease. Okay, so this is how it will act. And this is the mechanism of secretion. This we will now we will take just 5 minutes break. Just go and relax yourself, and then after that we will discuss with the mechanism of secretion. Go and have a sip of water. Okay, in the meantime I'll also just charge my iPad, and then after 5 minutes we will start with the lecture. Okay. Yes. Okay. So, yeah. So now see, beta, what happens is, this is a very good diagram. I should say that this is how insulin is released. So you can just quickly have a look here. I won't take this again in detail. You can simply say how insulin is being released and how it carry forward its function. And this is the glucose transporter GLUT2. And always remember beta, ये जो GLUT2 है, this basically, disconnect. So this GLUT2 is responsible for taking glucose to the beta cells of pancreas. And the most important thing beta which you have to remember is it is insulin independent. Right? Clear हुआ? Slowly you will study. In pharma you will study what is the use of this sulfonyl ureas, how they block, how they activate the different processes, right? And this is again insulin receptor. This is what you have to understand. Matlab, this is the right moment when you can understand this. Beta, is my voice clear to all of you? And screen is visible? Ready? Is the screen visible, beta? Just give me a thumbs up then. If it is clear, then I will start. Second. So now what happens here is that insulin always acts at the transcription level to regulate synthesis of more than 100 proteins. Right? Now, if I talk about, just now I told you insulin is what? It is a hypoglycemic hormone, okay, and released during hyperglycemia. So now you can just imagine hyper, make it hypo, hypo, making it hyper. So can you now imagine what is this? This is antagonistic relationship. This is a reciprocal regulation. Okay, right, Vanki, it's clear. Right. Okay. So I can simply say that now how insulin is working, it is simply releasing, it is increasing the uptake of glucose. It will basically take glucose to the tissues which are actually starving of hunger. They want glucose and this will help in that. So obviously glucose will be metabolized via glycolysis. So it is increased. It will increase protein synthesis also, because I told you excess amount of glucose, because glucose is the main hero acting here, which will lead to other processes. Excess will be stored in the form of glycogen in the liver and the muscle, and it will be required for the synthesis of fats also. So these are the processes which will decrease the concentration of glucose. And that is what is insulin is meant for. So if insulin is increasing the uptake, what are the processes which will be inhibited by it? Lipolysis means breakdown of fat will be inhibited, because insulin is helping in the formation of fat. How can it help in degradation of fat? It is but obvious. Similarly, it will not increase gluconeogenesis. Okay. Protein catabolism and glycogen breakdown. Matlab, it will never lead to any anabolic any catabolic process. So just if I have to summarize the entire diagram, can I write it here that I'll just add one thing here, that Now you have to understand this, that insulin is a anabolic hormone. Okay, anabolic hormone. So it will accelerate means accelerate all the anabolic processes. Right? Glycolysis is a exception. Glycolysis is an exception, as it being a catabolic process, being a catabolic process is activated by insulin. Have you understood this point? I'll just repeat it again. Insulin is an anabolic hormone, so it will accelerate all the anabolic processes. Glycolysis is an exception, as glycolysis is a catabolic process, lysis, breakdown of carbohydrate, but it is activated by insulin. Very important. Okay. On the other hand, glucagon. Abhi just now I told you what kind of hormone is glucagon. It is a catabolic hormone. So glucagon is a catabolic hormone. So obviously it will inhibit all the catabolic processes. Sorry, accelerate. I'll write inhibit. Why I should write here this 1 second. Because I am working, I am just, correlating this. So I will write it here only. It will accelerate. Okay, this is just a comparison. So it is an anabolic, it is a catabolic. So it will accelerate, it will accelerate, it will accelerate anabolic, it will accelerate all the catabolic processes. Up here, glycolysis is an exception. Here, gluconeogenesis is an exception. So I can say that gluconeogenesis is a anabolic process and is activated by glucagon. This is also very important. Right? Now the difference between anabolic and catabolic is clear to all of you. And the difference between the mode of action of insulin and glucagon is clear. Ready? Is it clear? Ready, and who all are there in the class? Is it clear, beta? Nala, is it clear to you also? Okay, any confusion till now? I think this is giving problem today. Is it clear, beta? Is my screen visible? Because I can see there is something wrong in the connection only. Right. Okay, so this is how insulin and glucagon act, right? And this is what is written here. Now, so if insulin and glucagon are working like this, I can say that insulin to glucagon ratio is there. Exists. So if the ratio is high, that means insulin will function. And if the ratio is low, that means glucagon is there. In the sense ki high insulin to glucagon ratio mein, I'll tell you what all processes will be accelerated. That I will discuss after this. Okay. Now see, coming over to the next slide, I can say that these are the hyperglycemic hormones. Okay. Beta, is there any confusion? If confusion is there, you can please ask me. So if I talk about hyperglycemic hormones, matlab kya hai? They are released when hypoglycemia is there. So glucagon is the one which is very important. Just now we have discussed epinephrine or adrenaline, glucocorticoids, ACTH, growth hormone, thyroxine, and they are anti-insulin hormones. Again, very because they will work against insulin. Okay, because insulin has altogether a different role to perform. Up coming over to glucagon. Glucagon is released by the alpha cells of the pancreas. Right? Up since it is that was a hypoglycemic hormone, glucagon is a hyperglycemic hormone. Right? So why glucagon is a hyperglycemic hormone? Because it is released during hypoglycemia. During hypoglycemia. What is the function of glucagon? It will increase glucose. क्योंकि hyperglycemic है. How it will increase glucose? It will promote glycogenolysis. It will depress, it will inhibit glycogenesis. It will inhibit glycolysis and it will increase gluconeogenesis. So I can say glycogenolysis will be accelerated, gluconeogenesis will be accelerated, and this will be inhibited. Clear? And these are also the same ones. Epinephrine, epinephrine is also synthesized in the body. They are known as catecholamines. It is synthesized from tyrosine. And its function is totally similar to that of glucagon because it is also a catabolic hormone. So it increases blood glucose. How? By promoting glycogenolysis, by promoting gluconeogenesis, and favors uptake of amino acids also. Right. Then comes glucocorticoids. They have also the same function. Secreted by the cortex, enhances gluconeogenesis and releases amino acids from the muscles. This is basically, you can say, amino acids are the ones which are forming protein. So proteins will be degraded. Right? And this is how the concentration is maintained. ये देख रहे हो, normal blood glucose concentration, insulin and glucagon, because they are working antagonistically with each other. Clear? And if I can write the functions, I can simply say this is a hypoglycemic hormone and this is a hyperglycemic hormone. Right? And this is a very good table. In fact, very important table. Now see, if I have to explain this table, I can simply say, beta, glycogen synthesis or glycogenesis will be promoted by insulin, inhibited by glucagon. If I talk about glycolysis, it is accelerated by insulin, inhibited by glucagon. If I talk about lipogenesis, it is accelerated by insulin and inhibited by glucagon. Protein synthesis, anabolic, you have to understand what are anabolic processes, but always remember one thing, glycolysis is an exception, right? And in glucagon, it accelerates all the catabolic processes. Here, gluconeogenesis is an exception. But that is all what you have to remember. Otherwise, it is very simple to understand. Okay? With glycogenolysis, if we talk about glycogenolysis, insulin decreases it, glucagon accelerates it. If we talk about gluconeogenesis, decreases, increases, lipolysis, decreases, increases, and ketogenesis, decreases, increases. Right? Now what happens is glucose is being synthesized, glucose is being utilized. Now sometimes what happens is we know what is the function of kidneys, that these kidneys help in the formation of urine. So whatsoever is important for the body, kidneys are going to reabsorb. Up for how long the kidney can reabsorb? Just say suppose if I am teaching you, if I teach you continuously for 3-4 hours, some students will leave the session in middle. They cannot study they can study maximum up to 2 hours. So that is known as threshold. Some have a very high threshold, some have a very low threshold. So same is the case with kidneys. They also have a threshold for how long they are going to accept, for how long they are going to reabsorb glucose. When they cannot reabsorb, they simply say no, and glucose is excreted in urine. Clear? Again, very, very important. So we call it as glycosuria. That process is known as glycosuria. When the renal threshold for glucose is exceeded, matlab kidney says no, that kidney just cannot reabsorb glucose because glucose has already exceeded in concentration. Okay? And renal threshold is 180 milligram per dl. If it crosses it, it leads to glycosuria. Excretion of glucose in, excretion of carbohydrate in urine. Right? See, when blood glucose rises to relatively high levels, kidneys also exert a regulatory effect. I say glucose is continuously filtered by the glomeruli but is normally reabsorbed also. And if the threshold increases, the extra amount appears in the urine causing glycosuria and also called renal threshold value for glucose. Very important. Right? And this is glycosuria. Okay, so normally the urine contains about this, which cannot be, and this cannot be detected by Benedict's test. Ab batao, what is Benedict's test? I told you it was the test for reducing sugars. An excretion of detectable amount of sugar in the urine is known as glycosuria. And glycosuria be, it is basically lag storage, renal glycosuria, but we are not going into that much detail. Diabetic glycosuria is very important. This is nothing but this is diabetes mellitus, when there is excretion of glucose in urine. ठीक है? अब जैसे suppose if I talk about renal glycosuria, you can simply say that this is due to lower renal threshold resulting in impaired tubular reabsorption. It is harmless. So blood glucose level will be normal. But if we talk about diabetic glycosuria, this is none other than diabetes mellitus. So diabetes mellitus, as the word suggests, mellitus sweet. So basically urine is sweet. Why urine is sweet? Because there is hyperglycemia, there is excretion of glucose in urine. Clear? This is diabetic glycosuria. And how we monitor blood glucose? We always monitor blood glucose basically with the help of grey colored vials are used. Grey colored vials are used. So basically in that grey color vial, what is the composition? Say this is the vial, and here this is grey in color where a anticoagulant plus sodium fluoride is there. Okay. What is the function of sodium fluoride? Sodium fluoride is an inhibitor of enolase enzyme. It inhibits enolase. So basically what happens is, because you must have seen, whenever a person comes and collects sample, he visits your home and collects the sample. He will always ask you what are the parameters which have to be estimated in the blood. So you'll tell him kya karna hai. So if he asks him glucose, if you tell him glucose, so he will immediately take a gray vial. He will take your blood and he will plunge that blood into gray vial vacutainer. Reason kya hai? Because it has sodium fluoride and it will inhibit enolase there and then. It inhibits, so whatever amount of carbohydrate, whatever amount of glucose is there in the sample, it will be estimated. Because we all know that life of RBCs is 120 days. So one has to transport sample from one place to another place. So in the meantime, glycolysis will keep on to stop glycolysis. And this I have already discussed in detail in my video on glycolysis. So if you guys have any problem, you can consult that video also. And then glucose oxidase method is the one which is most commonly used for the estimation of blood glucose. Is it clear? Then these are some of the normal values. These are the tests basically. See, fasting blood glucose, we designate it as FBS, fasting blood sugar. And a FBS is taken after at least 8 hours of fasting. It should be 8 to 12 hours of fasting basically. This is, suppose if you had your meal around 8 o'clock at night, so at least you should give some 8 to 10 hours of gap. That will be known as fasting blood sample. Then one is RBS. RBS is, it can be taken anytime. Random plasma glucose. Okay. Test done any time of a day without regard to time since last week. Or another is post-prandial PPBS, which is test done about 2 hours after a good meal. So these are the parameters, okay, which have to be taken into consideration when we have to estimate glucose in the blood. Is it clear to all of you? And these are the normal values. Okay? Fasting is 70 to 110. Random should be like less than 140, and postprandial should be 140 to 150 and all. So this is what is regulation of blood glucose. I hope it is clear to all of you. Any problem related to that? Or इसमें I think methods are also there. चलो हाँ, if we talk about, देखो चलो, we will discuss this also. When the concentration of glucose increases, basically what happens in hyperglycemia? Hyperglycemia में there are 3 main symptoms. Polyphagia, right? Polydipsia and polyuria. Means increased hunger, increased thirst and increased urination. And skin also starts becoming dry. Okay, too much food, too little insulin of this illness or stress. Right? These are the symptoms of high blood glucose. So we can say, देखो, hunger हो जाएगा, all the time the person will be totally drowsy, that lethargic kind of feeling will appear. He will have a blurred vision, because once I discussed that diabetic retinopathy is very, very important, and decreased healing. In case if there is a wound anywhere, it will require longer time to heal. Okay, then what we have to do is simply we can test glucose and we can call the doctor. Right? Then hyperglycemia. Hyperglycemia mein what happens is, again same, shaking will be there, fast heartbeat will be there, and sweating will be there. This is hypoglycemia, beta. This is hypoglycemia. This is hypo. When low blood glucose is there. So low में क्या हो जाएगा? Dizziness will be there, anxiousness, impaired vision, weakness, headache, and the person will be all the time in a irritable. So again, what we have to do initially, we have to simply, you can say, drink 1 to 2 glass of juice. Okay. And yeah, you can say within 20 minutes, we have to test blood glucose and then eat a light snack. Right. So this is all about a regulation of blood glucose. I hope it is clear to all of you. If any problem, if any question is there, you can ask me now. And if it is clear, then we can wind up the class. Is it clear, beta? Any confusion? If it is clear, then you can give me a thumbs up. And in case of any problem, then you can ask me now. So that's nice. Everything is crystal clear to all of you. Good to hear, good to see. Okay. So here we finish up with the metabolism of carbohydrates. Okay. And we finish up with the regulation of blood glucose. Right. So from the next session, we will be starting up with a new topic. So here one qualitative test for carbohydrates is the one which is remaining, which we will be discussing in protein metabolism itself. So we conclude the session on carbohydrates, chemistry and metabolism up till here. So thank you so much patiently for hearing this lecture. And again, we will be connected after this also. I've already told you about my Telegram channel. So whatever queries you have related to biochemistry, don't hesitate to ask. What I want is that this subject should be clear to all of you. Okay. So take care. Have a good day. See you guys tomorrow, same time, 11 to. Bye-bye.